Hello everyone, welcome back. Last chapter, woot woot! You made it through. This was a big course. So now we are going to finish up with chapter 29, which is plastic and reconstructive surgery. All right, start off with an introduction here. There are two aspects to plastic surgery. The first is plastic or reconstructive surgery. This is aimed at the treatment of defects and anatomical abnormalities that are present at birth or caused by disease or injury. We are focusing on restoration of form and function during plastic and reconstructive. This is our primary goal for that. On the flip side, we have aesthetic or cosmetic surgery. This is performed to improve appearance, but it does not always address function. So this is more of the appearance aspect of it. All right, many plastic surgery procedures are performed in outpatient centers or in the surgeon's office. A lot of times they will have some suites set up there in their office. However, if it's a more extensive procedure, then they will come into the OR for general anesthetic. Okay, as usual, we will start with a little bit of surgical anatomy. All right, we're going to start off with the integumentary system. This is our skin. The vital functions are to protect underlying tissues and organs, excrete organic waste and store nutrients, excrete water and dissipate heat. That's going to be our thermal regulation. And it transmits our touch, pressure, pain, and temperature sensors as well. All right, the epidermis. This is our outermost layer of skin. The primary cells in these are keratinocytes. The stratum corneum is the most superficial layer. It's relatively transparent and it's composed of mostly those keratinocytes, however, they are dead. It's thicker on areas of the body that are weight bearing, so our soles of our feet and our palms of our hands. Okay, next we have the stratum lucidum. These are dead and dying cells that are flat and tightly packed. It is also an extremely thin layer. Below that, we have the stratum granulosum, which is several cells thick, and these are where we produce our keratin. Underneath the granulosum, we have the stratum spinosum. These are undifferentiated cells. They become specialized as they migrate closer to the surface of the skin. And then finally, underneath that, we have the stratum germinativum. That's a mouthful. This is our deepest layer. It is attached to the dermis. The cells undergo mitosis here, producing daughter cells that will migrate through the layers. Our melanocytes are also found here, which, as you guys know as a review, are our pigmentation cells. Those are what are going to give our skin the color. Right, next we have the dermis. This lies between the epidermis and that subcutaneous fat layer. Provides nourishment and innervation to the epidermis. Blood vessels are responsible for oxygenation and thermal regulation in this area. And there's numerous sensory receptors here as well. Pain, touch, heat, and cold are a few of them. All right, then we have something called skin appendages. These are accessories to our integumentary system. One being hair. These are protective structures. They cover most of the body, again, except for the soles of the feet and palms of the hands. They are surrounded by follicles that lie in the dermis. Sebaceous glands are in those follicles, and they secrete sebum, which is a waxy kind of substance, grease substance that acts as a lubricant. And the erector pili muscle is what aids in the thermal regulation. That's what gives us our goosebumps when we're cold. It contracts the skin and keeps heat in. Okay, and we have our sweat glands. There are two. Apocrine glands are in the axilla and groin. They open out into the hair follicles, and an oily secretion is done there that has no odor. The only time that there is an odor is when that comes into contact with bacteria. All right, then we have eccrine glands. These secrete sweat over the surface of the body, and they cool the body then via evaporation. And again, that odor comes when it comes into contact with bacteria. And then we have sebaceous glands. These produce sebum. They are distributed on the entire body, except again for the soles of the feet and the palms of the hands. And they lubricate the skin and hair and prevent evaporation when that option is needed. Here's a diagram from your text that will show you those different layers of skin. We have the epidermis, we have the dermis, our subcutaneous layer. Here's an erector pili muscle, hair shaft, openings of our sweat ducts. Again, this is from your text, so you can reference it there as well. All right, moving on to a bit of anatomy of the face. Many aesthetic procedures, so remember those cosmetic only procedures, are performed on the face. Things like our rhytidectomies, which are facelifts, or mentoplasties, which is chin augmentation. Those are going to be on the face, and those are considered cosmetic. Soft tissues of the face include skin, fat, fascia, muscle, and ligaments. And the subcutaneous tissue layer is separated by a superficial musculo-laponeurotic system, or SMAS for short. This is specialized to the face, and it's just a term that you need to be familiar with. Right, moving on to a little bit of case planning. So prepping and draping for these surgeries, betadine is going to be used to prep the skin for procedures other than the face. Face and graft sites are usually prepped with non-staining agents, so our Hibiclens or whatever the surgeon may want to use, normally Hibiclens. Draping will be similar to techniques that were discussed in Chapter 19. With a few exceptions, face procedures may require a head drape, much like our ENT and oral maxillofacial surgeries. And if we're doing a debridement, we're going to want to use impervious pocket drapes that can collect the amount of fluid that we will use for that debridement and clean out, and it will collect and isolate that fluid as well. All right, instruments used for plastic surgery most cosmetic procedures only involve the skin. So our instruments for plastics are going to be short and have very fine tips. Sharp dissection for these are normally performed with tenotomy or Metzenbaum scissors, and fine-toothed forceps such as Adsons. Skin retraction is usually going to be done with skin hooks or small rakes. Sen retractors are common for procedures that will involve the skin and that fatty layer. And vein retractors are often used for our tendons and large nerves. Mosquitoes and hemostats are rarely used on the skin, but they may be used for dissection and bleeding vessels. And if we're doing any kind of bone remodeling, we will use our fine orthopedic instruments, such as periosteal elevators, freers, fine chisels and rongeurs, and things of that nature. Right, moving on to just a little bit about equipment that is used in plastic surgery. The first is the dermatome, which you should be relatively familiar with as you did your activity earlier in the class. These consist of a flat oscillating blade that is housed within an adjustable head. The instrument's placed over the lubricated, graft site and advanced forward, and then that blade, as it's advanced, is going to remove a uniform layer of that epidermis. And here we have an image of the handpiece itself here, which is adjustable, and the different blades in different sizes. And your surgeon will always let you know which size he wants to use. Okay, once we have our skin graft, it is going to usually be put through a graft mesher. Usually this is with the split thickness graft. It needs to be aerated or meshed before being placed on that recipient site. The graft's placed on a flexible plate and fed into the mesher. And this is our flexible plate here. We would lay our graft down on it, and then we would navigate this handle back and forth. And what that's going to do is feed this plate through and cut diamond-shaped holes into that tissue and cause it to come out with a mesh kind of appearance. The purpose of this is to prevent blood and serum from accumulating under that graft during healing. It also allows that graft to stretch, cover more surface area, and make a more precise fit over that donor site. All right, Power drills, pneumatic power drills may be used to model bone tissue with burrs or small cutters. They are used to create anchor holes for any kind of wires or screws we may be using. And we can also use the power drill. They do have attachments for oscillating saw blades that we can use for small areas of cutting through bone. And we will go over power drills in more detail when we get to the orthopedic chapter. All right, dressings for plastic surgery are going to provide protection and physical support to remodeled structures. More complex procedures might require a variety of different dressings. There is one procedure that is used called stenting, or technique, I guess. This is a specified dressing that's used for those skin grafts. It applies pressure to the graft tissue, ensures the graft becomes integrated with that tissue during healing. More recently, Dermabond has been used to maintain contact between that graft and recipient site, but we are looking here as to apply pressure to that graft site, again to prevent that accumulation of blood and serum, to make sure there is good contact between the graft and the recipient site so that that integration and healing can take place. And we're going to go through a few techniques here. And the first we're going to talk about is grafting. Obviously, this can play a major role in this specialty. You will see it quite often. So grafting is actually the surgical implantation of a biologic or manufactured material into an area of the body. There are two fundamental types that we will use. The first is biologic, and that's derived from living tissue. And then we have synthetic grafts that are derived from manufactured materials. There is something else out there called biosynthetic grafts. These are absorbed by the body or they enhance healing, but they are not derived from biological tissue. So they will react biologically, but they are not derived from biologic. All right, so just a little bit more on biologic grafts. There are a few different types. The first being the allograft. This is a graft that's transferred from one human to another. So these are human derived. Oftentimes they are harvested and then preserved and stored in tissue banks until they are needed. Common types that we use on these grafts are skin, bone, and cartilage. Once they're implanted, they are incorporated into the recipient's tissues and eventually absorbed. Okay, next we have the autograft. This is a biological graft that's taken from one area of the body and transplanted to another on the same patient. So these are grafts that we are taking from the patient for the patient. They're commonly skin, bone, cartilage, and fat is what we are transferring here. And then we have a composite graft. This is a biological graft that consists of more than one tissue type. And that's going to be classified according to the method of transplantation. So this is going to be surgeon specific. Usually a briefing will be held before the surgery between the surgical team and the doctor so that we can decide and plan our case accordingly as to what kind of instrumentation, dermatomes, measures, if anything's going to be needed. That will be decided prior to the procedure. And last but not least, we have the xenograft. And this is made up from, made up of tissue from one species that is grafted into another. So oftentimes we will use porcine, if you remember that comes from pigs, or bovine, which is cattle. A lot of times we will use porcine or bovine skin and graft that to a patient if need be. All right, moving on to implants that are used. Implants are a synthetic, natural, or biosynthetic substance that are used to fill in or replace a structure. One thing that we need to keep in mind for implants, no matter what specialty you're working in, is that once that implant is on the sterile field, it should be handled as little as possible. It is a good practice to, a lot of times these implants will be double packaged. So a lot of times my own practice will just leave it in that package And when it comes time to hand it to the surgeon, I will just peel back the paper that's on it or the plastic or whatever it is encased in, and I will hand it to the surgeon still in its container so that it is literally only touching one set of hands. And that's strictly just to prevent contamination possibilities, lessen the chance of infection rates and things like that. All right, Silastic implants need to be kept free of lint. If we are using those, we want to make sure they are not around our gauze, our sponges, or our towels. Silicone has actually been used since the 50s for implantation. It's proven durable and strong and safe. The harder the silicone, the more stable it is. And something with silicone is that we need to have sufficient soft tissue coverage, and that will prevent chronic inflammation once it is implanted. Okay, we also have polyethylene, also called Medpor. This is porous. It has very little inflammatory reaction, and it does remain stable. And then we have Gore-Tex. Gore-Tex is commonly used for cardiovascular and facial augmentation. It is inert, meaning that tissue infiltration into this is minimal, so it's easy to be removed at a later date if needed. Okay, moving on to debridement. This is the process of removing disease, damage, or infected tissue. Burn patients often require frequent debridements during their healing process. Grafting for these patients cannot take place until all the debridements are complete. There are a few different kinds of debridement. We have chemical debridement, which is enzymes used to dissolve tissue. These might be impregnated into their wound dressings or introduced at the time of the debriding. Surgical debridement is when tissue is removed with sharp dissection using surgical instruments. All tissue that is removed needs to be removed from the sterile field, isolated and confined. This is considered a contaminated procedure, and that's for obvious reasons. If we are taking off this disease or infected or dead tissue, we do not want to introduce it or have the chance of introducing it to that healthy tissue that we are uncovering underneath. Okay, and it can also be done with pressurized saline. This is performed using a fine jet spray of tissue. It's commonly used in burn and trauma patients. Okay. As you can imagine, these are not pleasant procedures. It is very painful for these burn patients, so they will be taken back to the OR oftentimes and put to sleep for this. Another key point when we're doing surgeries for burn patients in the OR is that the room will be kept incredibly warm. We're usually at about 77 to 78 degrees in that OR suite. And that is because these patients have lost those layers of skin, so they have no thermal regulation. So we need to bump up the temperature in that room to keep these patients warm while we are debriding. All right, when we're talking about tissue remodeling, we're talking about techniques for sculpting and augmenting. And just remember as a term, augment is the surgical procedure in which the size of a structure is enlarged. All right, we can use synthetic or biological grafts and implants for this. Soft tissue, when we're sculpting, is sculpted using sharp or blunt dissection, or it may be done with a laser. And dense or connective tissue is usually sculpted with a variety of drills and bone cutters, depending on what we are working on. All right, and that right now is where we are going to end this. We will go through procedures in class again. I believe Ms. Stolp has something planned for you guys for that. As I will be gone now for the next few days, I will be back on the 18th, so I will see you all in lab. If you have any questions, please make sure to leave them here, and I will see you guys when I get back. Good luck on your final. I'm sure you're all going to do wonderful on it. I have no doubts, and I will see you then.